Anyway, with this, Dr. Greenblatt, sorry he couldn't be here to join us tonight, but we feel so lucky to have Sharon Houseman-Cohen with us tonight. And with that, let's let it all begin.
Hi, nice to see all you guys virtually. And tonight we're going to talk about ADHD. All of you know that sometimes stimulants are not the answer, and you wouldn't be studying integrative psychiatry if you wanted to just use the usual, which would be stimulants. So instead, we're going to look at the root cause approach to ADHD, looking at genomics. As Cindy said, I am the co-founder and chief medical officer of Integrative DNA, which is a clinical decision support tool that helps allow physicians and other licensed healthcare providers to use genomics to make better decisions. If you are watching this video, you are agreeing that you are not using the information presented to create a genomic product or tool or to reverse engineer the information, and that you're not associated with a genomics company with a commercial product. This is for educational purposes and your education. As a disclosure, I am, as we said, the Chief Medical Officer of Integrative DNA. So what are we going to talk about tonight? We're going to talk about different pathways that contribute to ADHD so that you're comfortable with some of the root causes, but also we are taught in medical school, don't order a test if you don't know what to do with the results. So we'll go into how you can specifically address different genomic variants, and also how you can talk to a parent about someone's medication response, because many individuals have genomic variants that actually make them poor responders to stimulants, and that is a motivational factor for parents in terms of why to use a root cause approach. So it just kind of helps to further improve their compliance. Before we talk about the genomics, let me just remind you a little bit about ADHD. ADHD is a huge burden to an individual and a family, and the numbers are growing. It's not a huge increase, but in 1997, it was about 6% of children, and now it's over 10%. It's been shown that it's 5 times higher cost to raise a child with ADHD than other children, and there's also significant higher unemployment rates. So there's a lot of reasons to optimize a child's brain function, whether you're talking ADHD, depression, anxiety, and it also can affect their personal lives. The other really key point before we talk about root causes is ADHD is not one disease. So there is not one ADHD gene. There's no one etiology. And this is true of most chronic diseases. Last year, I taught at IMMH about depression and anxiety, and it's the same thing. Chronic diseases that are common don't have one cause, but they have multiple smaller contributing factors that together interact, along with diet, lifestyle, even what nutrients you're on, etc., to create a disease. Another important concept for ADHD is that successful neurotransmitter regulation is central theme. You'll see that if you can't convert dopamine to norepinephrine, that's a big deal. If you have dopamine dysregulation, problems with with decreased metabolism of your neurotransmitters, all of those things contribute. But also differences in neuronal connectivity and migration and glutamate are also important. So what we're going to talk about is, rather than throwing a whole cadre of different interventions at an individual, is being able to identify from a list of many dozens of things that can contribute to ADHD, what's affecting that patient that's sitting across from you, and what can you do for them? Another important concept is that nutrient deficiencies contribute significantly to ADHD. Having low B12, having problems with folate metabolism, having problems with zinc deficiency, which is a cofactor for neurotransmitters. All these things, magnesium, which is a cofactor for GABA, can contribute to focus and concentration. And so it's important to understand how some of these different combinations can give rise to different treatments for the same disorder. And that's really because, as I said, ADHD is an ICD-10 code or whatever numbers we're up to of the DSM. And it is really just a generalized code for a collection of symptoms and does not really identify the etiology. So what we're going to do is we're going to talk about a few variants that contribute to ADHD, and then I'm going to do a case study because I think that really helps bring it to life. So first I'm going to start with brain connectivity because connectivity is so important to the brain function of the child and of all individuals. And there are a couple of really important brain connectivity genes that dramatically increase the risk of ADHD. I'm going to focus on two of them, what I call contactin or catnap and AdGirl. And again, don't try to memorize the formal names of these genes. Your patients don't care. Just kind of use the abbreviations and kind of get the broad spectrum. This is a connectivity gene. This is a dopamine gene. Just to let you visualize connectivity, it's kind of like one of those connection games. You want the proper receptors and presynaptic and postsynaptic gene neurons to talk to each other. And if they can't migrate and the neurons don't migrate and connect properly, you're going to have problems with processing. So a lot of what we talk about when we talk about connectivity genes also relates to processing. And that's particularly true for contactin or catnap. So CNTNAP2 encodes a protein called Casper2, which is also called a contactin. And it also is part of this family of connective proteins called neurexins.
Sharon, your slides are not on the screen.
They are not?
No, but you look great. I just want to say.
Okay, well that means the sharing. Okay. Okay, so I'm going to go real quickly back.
Oh, some people can see them. Can everyone?
Okay.
Okay. Some people are seeing them. Okay. I can't see them, I guess. Okay.
It's probably
and a few people have said they can't see them. Okay.
So if anybody's having problems seeing the slides, go to your command bar and there's a way of what you show and you can change the way you show. So instead of seeing Cindy and myself, you see the slides. Okay. So contactin is about speech and connectivity because neurexins are connection proteins. And what I like to do with these different gene variants is kind of come up with my basic framework. And contactin is about connectivity, but it's particularly about connectivity in speech and auditory processing. So when you have problems with contactin, you tend to have problems with auditory processing. Well, what happens to a child that's sitting in a classroom with a teacher, just as if you couldn't see my slides, and you have a teacher sitting in front of the child in the classroom talking and talking, but the child isn't using anything other than they're listening. There's not a lot of visual going on. Well, they're going to be distracted because they don't auditory process well, and they're going to get labeled with ADHD. So lower contactin activity, which is conferred by this particular SNP, relates to changes in how you perceive voice, problems with auditory processing, and auditory learning. Now, there's another gene called FOXP2, and it's a protein that regulates the transcription of contactin. So one of the things you're going to see when we talk about modulating contactin is if we can increase the regulator, kind of increase the on switch, then we're going to be able to increase the downstream pathways. Before we talk about how to modulate it, we learn a lot about genes, not only from human studies, but also by knocking out genes in animal models. If you knock out the contactin gene completely in rats, you have the same kind of symptoms happen: delayed development of auditory response, as well as problems with being startled more easily and sensory filtering. So this is really interesting because the other thing contactin relates to is autism. And you can see a lot of those kind of people who don't like to be startled is a common theme in children with autism. So it's a disruption of sensory processing. And with autism, it's again the same gene that causes 2.7 times the risk of ADHD also contributes to higher rates of autism. Just to get you a little bit oriented on odds ratios, when I say something has 2.7 times the risk of a disease, that's an odds ratio. But if I was converting it to percent, because 100 is a percent, that would be 167 times more likely that somebody who has this gene variant gets diagnosed with ADHD than somebody who does not have this gene variant. We also can look and see that the changes correlate with reductions in the way the brain is structured, changes in both their gray matter and white matter, which are seen in both ADHD and autism. So what do we do for somebody who has one or two of these contactin variants, especially two of them? Well, the first thing is to give them different ways to learn. Let them take notes. Let them do experiential learning. So even if I have an 8-year-old child who has this, and they might not be great at taking notes, even a 7-year-old child, I'll let the parent and the teacher know, let the child take notes. They might be even drawing, but tell the child, start to train them to start to write down what you hear the teacher saying so they can be using other processing pathways. If they're trying to learn something like how to play an instrument, learn it experiential, letting them play with manipulatives for math, all those things can help. We can also regulate contactins regulator. We can address the regulator, the FOXP2. Well, how do you address FOXP2? Well, a diet high in omega-3s upregulates FOXP2. In fact, they also showed that you can get a head start on this if you know that a mother has ADHD or has contactin variants. You can have a diet that is prenatally high in omega-3s. A lot of times you will do things with supplements because of the risk of fish having a lot of mercury, and that lowers ADHD risk in the child, which is great. And so again, if you're counseling women that are pregnant, having them get enough omega-3s is a great way to help decrease their child's likelihood of ADHD. Vitamin D, a really simple regulator of FOXP2. Fetal vitamin D deficiency reduces FOXP2 levels. So again, this is something that the earlier you can start, the better, prenatally or early on in childhood. And if you, again, even start at a child that already has been diagnosed, it's still going to help. Now, vitamin A is another thing that can regulate FOXP2. I don't tend to prescribe a lot of vitamin A because I want the kids to eat the high vitamin A foods. I tell the mom to use the mom and dad, to use sweet potatoes, sweet potato fries if they're using fries, carrots, foods that are rich in the vitamin A, and supplements if necessary. Oxytocin is another intervention that can help with contactin. Of course, it helps with social skills, but we also know that contactin ultimately lowers oxytocin, and that oxytocin administration helps with some of the social deficits caused by lower contactin. And so, such as impulsivity. You don't have to necessarily prescribe oxytocin. There are certain probiotics, Lactobacilli reuteri, for example, that can help upregulate oxytocin production. So again, there's all these tricks that you can learn in integrative medicine that can help you be successful as an integrative psychiatric clinician. Now, contactin also is associated with lower GABA release. I don't like to give GABA to someone during the day because what do we use GABA for? Help people sleep. But what I do like to do is upregulate the GABA receptors so they have better GABA signaling. So think of the receptor kind of like the lock, and think of the GABA kind of like the key. If you have more locks or more docking stations, it's easier for whatever you have to dock to find a docking station. So theanine makes it so you have more GABA receptors, so it increases GABA signaling without causing any fatigue. And it also has great studies in ADHD related inattention. Taurine also is another option that has been shown to increase GABA signaling and reduce hyperactivity in ADHD patients. The second part of these sentences is very important. when you're looking for an intervention for a particular gene, you want one not only that can address the gene, but also addresses the disease state that you're trying to address. Because not every intervention crosses the blood-brain barrier. So something that might affect inflammation in the periphery for hypertension or skin inflammation might not work for brain inflammation, even if it's related to the same gene. Let's go on to the second one. I call this one ADGirl or ADGirl3. This is a really interesting gene because it is involved in cell adhesion and neuronal migration. So again, gets involved very, very early on during development, and it enhances your brain activity so that you get better connectivity of the memory center and of all the different parts of the brain. But the reason that this is so interesting is this is the only gene in the literature that has been associated with high risk of ADHD being diagnosed before age 7. So when you have those kind of hyperactive kids that come to you at 5 and you're like, okay, I've got to put away the stuff in my waiting room. I've got to kind of clean up my exam room because they're going to be pulling the couch apart to see how it works and just kind of all over the place. Chances are they have ADGirl3. One copy increases the risk 23 to 50% of ADHD, but 2 copies increases it 290%. And again, this one, for some reason, seems to be more significant in males. They don't fully know why. If you look at an animal knockout model, you can help understand some of the different phenotypes even a little bit more. So if you knock out ADGirl, the mice are hyperactive and impulsive and have difficulty with learning, including their spatial memory. Although they were impulsive, though, they were not aggressive. They actually had increased sociability. And you see this in some children. They don't have that concept of personal space. They're really sociable and maybe even hugging and impulsive and doing things that not really picking up on social clues, or being too social, but in ways that other people might not like. Now, because ADGirl does seem to do some interactions with dopamine, which we can talk about if we talk about addiction or other topics at some time, ADGirl also is linked a little bit to substance use. It's because it affects your dopamine reuptake and you have more dopamine in the synapses, is what they think. And so it can be associated with drug-seeking behavior. If you have a gene that you know is associated with drug-seeking behavior, do you want to put that 7-year-old on a stimulant, which can be addictive? Of course not. Do you want to put that high schooler or college student on it? Not if you can avoid it. The other thing to know about stimulants, and again, we can talk about a little bit more in detail in a later slide, is long-term use of stimulants. So you're starting a middle schooler or an elementary school child on stimulants. Long-term use of stimulants is associated with an increased risk of Parkinson's. So what can we do other than stimulants? Stimulants can help with this gene. And in fact, they do get improved efficacy with stimulants. But if you can avoid it, there are also other options. So because the stimulants improve the response for attention, but worsen the hyperactivity. And that can be particularly problematic in a child that is younger and can't sit still in a classroom. So what is a non-stimulant option? If I could see all of you, if we were in a classroom, I'd say raise your hand if you've ever prescribed citicoline. Citicoline is a form of choline that is attached to a molecule, a uridine molecule that helps it get into the brain. And so it's CDP choline. And the way I describe choline to my parents is if you think of the wires that go through a wall, the red, the yellow, those black wires that are connecting our electricity, the wires wouldn't transmit electricity well if they didn't have the insulation. Choline is a huge part of neuronal insulation. So choline helps with the neuronal connectivity, whether you're talking about a stroke patient trying to heal, a cognition patient, or a child with attention problems. So it is a good option for inducing increased synaptogenesis, the formation of new synapses, and neurogenesis more connectivity and neuronal growth in individuals with ADGIRL3. On all of my slides, you're going to see references. We've talked about genomics clinical decision support tools. What makes a genomics tool the category of a clinical decision support tool is that everything has to be referenced and give you the ability to understand. If you had time to click on all the references, you'd be able to follow what's going on. So that's kind of what we're doing today, is teaching you how to use genomics for clinical decision support. Now, support for genes doesn't have to be just about supplements. We've already talked about food, but there are also other interventions. Many of you may work with people in your community that do biofeedback. And biofeedback or neural feedback is great for connectivity pathways, especially if you can start it younger, before puberty. There's lots of different kinds of neurofeedback. There's like 4-channel is a great form. And there's, again, you can talk to your biofeedback center. But usually the best way of doing it is going to someone who can map their neural connectivity and do it in a very specific way. And we know from functional MRI studies that using these different kinds of biofeedback tools can improve those neuronal connectivity networks, and we know from measurements it improves ADHD outcomes. So the next topic that we're going to talk about is neurotransmitters. And don't worry, I know we're going through a lot, but remember, all of this is documented. If you're going to use genomics for making clinical decisions, you're going to use it in a form where it explains to you what the gene variant does and what are the different interventions. So you don't have to memorize this. This is to help you get comfortable with why you would want to talk to a parent about using a precision approach to your integrative psychiatry. And so you learn more about root causes. So the next topic we're going to talk about is dopamine, serotonin, norepinephrine. And with ADHD, we focus a lot on the dopamine-norepinephrine connections and ratios. So dopamine, norepinephrine, and serotonin are the 3 main transmitters involved in ADHD, with heavily focused on dopamine and norepinephrine. Dopamine is that do it again, but it's involved in your reward system, but it's also involved in motivation and working memory. High dopamine is the opposite of Parkinson's. So it's also involved in movement. So if you think about the individual that has Parkinson's that can barely move, barely walk, the child with high dopamine or dopamine transmission with ADHD, they're all over the place. Norepinephrine is concentration, recall memory, certainty, determination. It's really an important part of attention. So if you can't convert dopamine into norepinephrine, that's a big part of ADHD. Serotonin is more part of depression and anxiety, but it also does contribute to relaxation, pleasure, and learning. Now, it's not just about how much of these neurotransmitters you make. It's also about how much you metabolize them or reuptake them or remove them. How much do you release them? And how are their receptors working? And so all of those different things can contribute to the genomics. And again, I'm not going to teach you all of the brain genomics tonight, but let's do a couple of samples. And I've chosen some that relate to dopamine and norepinephrine so you can see how this works to add precision to your clinical decision making. So as we said, dopamine is involved in reward and reinforcement as well as movement. And alterations in dopamine signaling relate to ADHD, OCD, and substance disorders. Now, if dopamine's too high, it's problematic. That's the ADHD hyperactive child. If dopamine's too low, you can have problems with motivation. Low dopamine is also associated with restless legs. One of the genes that you will find involved in ADHD is called ANK1. ANK1 interacts and is near DRD2, which is a dopamine receptor, and it causes dysregulation. Let's talk more about what that means. So it lowers your presynaptic dopamine receptor density. So that causes problems with autoregulation, which means normally once you've released enough dopamine, you're going to turn off dopaminergic production. But if you have less autoregulation, you can't turn off the production and you just keep releasing more and more. That's dopamine dysregulation. So this gene is associated with 78% increase in ADHD, even with one copy. And it's very common. One copy is in 30% of the population. So it doesn't cause it, but it's a strong contributing factor. It's also associated with increases in impulsivity and avoidant behavior and compulsive addictive behavior. It's also associated with food addiction and obesity. So there's lots of things that high dopamine relates to. What do you do for a child with high dopamine? One of my favorite interventions that many of you may have heard of, but maybe you haven't, is Bacopa Moneri. Bacopa helps to decrease that dopaminergic signaling, but it also has good evidence for mitigating ADHD. The thing about Bacopa is it does take a few weeks, 3 or 4 weeks to get to full effects. But what you'll see is it decreases restlessness, improves self-control, learning improvement, ADHD symptoms. And in this study, using 225 milligrams a day, the scores were impressive. 93% reduction in restlessness, 85% reduction in attention deficit rating symptoms, 78% reduction in a learning problem scale, impulsivity, 67%, 89% self-control. So this is something that would be a great tool to add to your toolbox, whether or not you're using genomics, since a third of children have a dopamine dysregulation. And for the ADHD with the hyperactivity, it's going to be even higher. Now, I mentioned that you can't possibly memorize everything I'm telling you. Don't worry about it. This is an example from a genomics clinical decision support tool, and you can see how the information, including references and things with dosing, can all be in this tool. So you don't have to, you just have to know where to find what you're looking for. You don't have to memorize everything. Here we have another gene, and you can see, again, with the genomics clinical decision support tool, dopamine beta hydroxylase in blue correlates to higher dopamine, lower norepinephrine. Let's just take a moment and look at the key point. Individuals with this SNP are prone to having lower levels of norepinephrine, which is motivation and concentration, and higher dopamine. And that low norepinephrine leads to ADHD, depression, and hypotension, low blood pressure. Higher dopamine leads to ADHD, binge eating, and addictive tendencies and gambling. So DBH is the enzyme that catalyzes the conversion of dopamine to norepinephrine. So it makes sense that individuals who have low DBH, 2 copies of this gene, have high dopamine and low norepinephrine. Now, if you have this gene variant there's lots of ways of the numbers. It's the 44G, A, and there's RSIDs. But if you have 2 copies of this gene variant and 2 copies of another dopamine beta hydroxylase gene variant, you can have 15 times the risk of ADHD. So that's another one that's important to know about. What do you do for these individuals? Well, what you're really trying to do for these individuals is increase their norepinephrine. They've got lots of dopamine, but they're stuck. And norepinephrine is motivation and concentration. What do we need in order to be successful in school? The ability to stay focused and concentrate. So motivation and concentration are super important. Now, because norepinephrine and epinephrine also are involved in blood pressure regulation, these individuals often have a little bit lower blood pressure. So even if you're a psychiatrist, sometimes you might not think about taking blood pressures, but if you have a child that has ADHD and they're tired, they're wanting to lie down a lot, you should check their blood pressure. A lot of times these kids have problems making enough of their norepinephrine and their adrenaline, so they're tired. Their blood pressure's low. They lie down so they get more blood flow to their brain. And just giving them extra salt can be really beneficial. Now, with increasing norepinephrine, one of the first things I recommend is to help your gut do the work for you. There are certain probiotics that increase norepinephrine production. Many of you may know that there are specific probiotics that increase oxytocin. We just talked about that. There's specific ones that increase serotonin. That's more like Lactobacilli helvetica and Bifido longum. But there's other ones that increase norepinephrine, like Saccharomyces and the spore-based probiotics. So understanding what probiotics help make what neurotransmitters is a great option. But you can also give the key cofactors to push the norepinephrine pathway. What is a cofactor? Well, think about if you're making bread. Flour is the main ingredient, but if you don't have salt and baking soda or baking powder, the muffins or the flour are not going to rise, or yeast, or whatever you're using, depending on whether it's a quick bread or a yeast bread. Those are cofactors. The cofactors for making norepinephrine, so the main ingredient for making norepinephrine is methylfolate. Well, actually, the main ingredient would be tyrosine, which gets converted to dopamine. But then the cofactors are methylfolate, but also vitamin C, copper, zinc, exercise. So all of these things can help children with ADHD that have DBH issues. There is a prescription medication that can raise norepinephrine, but my guess is most of you are never going to use this in your life. And the reason for it is the FDA indication is really only for POTS. It's very difficult to get it approved. So POTS is postural orthostatic hypotension, the kids with people with super low blood pressure where it drops when they stand, and it's very expensive. You also have to be very careful when you're using it that you don't overshoot and raise their blood pressure. So purposely, this medication is expensive, takes prior authorization, and if you're not somebody who does a lot of ADHD, you're likely to never try to even do a prior authorization for this. And there are a lot of other things you can do. One thing that people often think about is, well, if tyrosine is the precursor to norepinephrine, maybe I should give tyrosine. Don't. That's why we have the warning sign with the red triangle. Tyrosine is the precursor to dopamine. In this special situation with the problem with converting dopamine to norepinephrine, if you give too much tyrosine, what happens is you just make more dopamine and you still have problems converting it to norepinephrine. So instead, we want to give the cofactors that push the conversion of the dopamine to norepinephrine. Again, genomics is not something you can memorize. In our mental wellness genomics report, if you do the full report where you're doing addiction and ADHD and depression and anxiety and all these different mental health things and nutrients, you're talking 400 SNPs. No one can memorize that. So you're going to use a genomics tool to help jog your memory. What can I do to increase norepinephrine? Oh, I can do vitamin C and copper and zinc. I can also do ginkgo biloba to inhibit the norepinephrine reuptake. And so it's going to talk about what you can and should not do in different cases. Speaking of cases, let's see how we're doing on time. We're doing great. I'm going to apply what we've just learned to a case study so you can see how this is used. And then we'll talk a little bit about medications, and then we're going to take some questions. There is a chat box. I see some of you are already putting questions in. Please put your questions into the chat box so I can make sure I answer them. So we're going to call this patient Adam. The case is called ADD mathematician on the ball. And the reason I named that as the case is this particular young adult, he's 20 years old, he's a college student, was an avid basketball player. He has ADD, denies hyperactivity, but he is really wanting to succeed well in college. He's a math major and needs to have more energy because he wants to go on into, maybe aerospace engineering or physics or something like that. And he's like, I'm having trouble. I sometimes can't even figure out where I put my paper. I forget to turn in assignments. I lose my cell phone. I also have some anxiety, some OCD, some mild Tourette's type symptoms as he was complaining of. and he feels like coffee and stimulants help, but his mother wanted him to come and get a second opinion because when he takes the stimulants, his tics are a little bit worse for the next few hours, sometimes even longer. So the first thing we see, and I'm doing kind of an abbreviated case, is this young adult has the condactin genes that make him have less brain connectivity. He's probably a little too late to do biofeedback, not to mention he's at college and probably doesn't have time. But what can we do for him? So interesting to me was his choice of majors. I eventually saw his brother as well. His brother only has one of these gene variants. He was a math major. His brother was like poli-sci. So he chose an area where he didn't have to be as verbally fluent. He also had the tics, and condactin has also been associated with Tourette's. We know that vitamin D and omega-3s have been shown to improve tic severity in Tourette's. So we're definitely going to use those as interventions, but maybe we'll use some citicoline as well. We definitely will talk to him about diet with adequate vitamin A, getting sweet potatoes. That's easy, things like that. And we'll definitely talk about developing non-auditory learning strategies. And he had already figured this out. This young man was a musician. He's written songs, but when I talked to him about how he learned, he did a lot of figuring out just the fingering, and would study music and just kind of realize that if he just did it, he had good kind of muscle memory, and that if he took notes in class, if he wrote out equations, he could remember things quite well and did a lot better. So experiential, visual, taking notes. Remember, he reported anxiety at times, so I don't have time to go into his anxiety genes, but in choosing what I wanted to use for his ADHD, I chose theanine from green tea because it increases GABA receptors, which helps that helps the condactin pathways. But GABA also has calming effects, and so that can help with anxiety as well. Interestingly, there was a study done in college students in Japan that were studying for the equivalent of our LSAT, of our law school test, and it was just an all across the board study. They gave them theanine along with a little bit of caffeine, because some people theanine can make them a little bit sleepy, but if you give it just even a small amount of caffeine, like the amount that would be in chocolate milk or a cup of tea, then that blocks any sleepiness effects. And they showed that the students did better on their exams. So it's been studied in ADHD, but also in normal students just under stress taking a test. Adam also had a variant that showed up in his ADHD pathway that also overlaps with anxiety, called COMT. Again, if I could see a show of hands, many of you have probably heard of COMT, but COMT is involved in the metabolism of norepinephrine and adrenaline, but also dopamine. And it causes you to have higher adrenaline and norepinephrine under stress due to taking a longer time to break down your adrenaline. Now, COMT is not necessarily a cause of ADHD. COMT is a behavior SNP that relates to how people respond in different situations, including when they're frustrated. And so it's interesting, individuals with two variants in COMT tend to get frustrated easily when their stress hormones go high, and is associated with social impairment. The way I describe COMT is when somebody gets upset, let's say their friend tells them something they don't like, or their teacher, or they feel like someone was being unfair, the normal person will get their adrenaline going, and it might go high for 5 or 10 minutes. But the COMT met individual takes 4 times longer to process that adrenaline. So they're hanging on to it for 30 or 40 minutes. The reason I wanted to highlight COMT is early life environmental adversity also has a relationship with COMT. So if somebody is in a high socioeconomic class versus a low socioeconomic class, where there's stress in their home, they're worried about having enough money for food, lots going on in the home that just creates a stressful atmosphere, that can make this worse. And the reason is those individuals are going to have high cortisol during the time when their brain is developing. And high cortisol affects neuronal connectivity and memory retrieval. So just another good thing to think about with early life and early childhood. From an attention standpoint, it's really interesting because ADHD is defined differently in different cultures. So in Japan, they value that high achiever, kind of hyper vigilant child that's going to be an overachiever. We value that to a certain extent in America as well. And having two copies of the MET, of having that high adrenaline, has been associated with high achievement. So it's not necessarily bad. So in Japan, they consider having low COMT, low adrenaline, a risk factor for ADHD. And so again, I think it's genomics is really interesting. So a gene is not good or bad. Genes help define who we are. The people who have two variants, which is about 24% of the population, have that higher adrenaline, higher dopamine. They might get angry more easily. They have problems with inflexibility and switching from one class to another, moving away from negative stimuli, more anxiety. And the Val, there tend to be more conduct issues, oppositional, defiant, but also less anxious to kind of be go-getter behavior wise, and don't necessarily pay attention to social norms. The other reason I chose to focus on COMT as one of our genes, besides for the fact that Adam had two copies, is COMT is associated with a lower stimulant response. This is really important. If you have AA, which Adam had, then your likelihood of getting a good response to stimulants is 12%. So this is important because remember, Adam felt like taking coffee and stimulants was helping him some, but it was also making his tics worse. So getting him to at least come down on the stimulants and eventually get off of them was an important goal for me. COMT also affects white matter connectivity and a higher stress response that we've talked about. Now, I want to point out something else about COMT. When I saw Adam was at the beginning of the coronavirus epidemic, and I did a webinar for all my patients, and I was talking about lots of different things, including how quercetin can help you uptake zinc and has certain benefits. I just mentioned it in passing as I was going through studies, but retrospectively, I shouldn't have mentioned that in a general webinar because quercetin further inhibits COMT, and individuals with two variants don't tolerate it well because it makes you have even higher adrenaline. So Adam called me and he said he got more anxious. We went through his supplements. His mom had him start taking quercetin, and that was the culprit. So just another fun thing when you're learning integrative medicine, you're going to make some mistakes. It's okay. Just be open-minded to thinking, what could I have done? Retrace your steps and kind of go back and look at the literature, look at the genomics tools. So what is a different option for Adam? For Adam, for his COMT, ashwagandha is great, bacopa is great, valerian is great. And there was a combination of bacopa, ashwagandha, and valerian that was used in an Ayurvedic study where they improved auditory reaction times, 45%, total reaction times, visual processing, and overall decreased ADHD symptoms, including restlessness and inattention. Because of what was available in Adam's college town, we just started with ashwagandha. Also, he didn't want to take a lot of things, and ashwagandha kicks in quickly. And so you can see that ashwagandha very quickly improves memory and focus in adults. And this study was done in individuals in their 20s, and within 14 days improves symptoms. For me, and I'm willing to admit that I'm a double COMT. Many people who work till late hours of night are. For me, ashwagandha is great for helping me to have a calmer day. So it's a great, in studies of stress reduction, ashwagandha has been shown to decrease the perceived stress score by 47%, which is great. We talked at the very beginning about nutrient pathways, and Adam's magnesium pathways were also highly significant. When I ask patients who have lots of magnesium SNPs about their health, you'll often find that they get muscle cramps or twitching, and Adam had both. Additionally, after Adam had his wisdom teeth out, he woke up with palpitations and fell off and had more pain. All of these things relate to magnesium. So we talked about using magnesium. You can use magnesium glycinate orally. You can use magnesium threonate to get into the brain, or you can use topical magnesium. But magnesium is a cofactor for GABA synthesis. So it makes sense that you want to optimize magnesium in somebody with ADHD with these other gene variants. Let me go quickly back to the medications, and then we'll do questions. This is what I was alluding to at the beginning. Patients with ADHD have 2.4 times the risk of Parkinson's. If you give them stimulants, the risk of early onset Parkinson's, meaning before age 50, is 8.6 times higher, or 760 times higher. So many children don't even genetically respond well to using stimulants. They're really not a great option. So doesn't it make sense to identify root causes and try something else first, especially if they're going off to high school or college where addiction is at higher risk? We talked about CompT. AAs only have 11% chance of a good response. AGs 41%, GGs 62%. But there's other genes as well that make it so you can lower your response. DRD3, a different dopamine receptor, decreases response to 46% likelihood to respond instead of 74%. If you have a tyrosine hydroxylase SNP, which is 25% of the population, you're more likely to have problems where you don't respond well, along with other SNPs that relate to you getting kind of overactive, overhyper, more elation, more vigor. There's also SNPs that relate to other drugs and how they respond. So it's great to look at drug response, but if you're going to do an integrative approach to ADHD, I think the first thing that makes sense is addressing nutrients that are important cofactors for making norepinephrine, dopamine, and GABA. Then address the variants that contribute to connectivity. Address the neurotransmitter imbalances using diet, lifestyle, and supplements before you jump to medications. And always remember to talk to parents about root causes before going to stimulants, and let parents know that it's not that you are, trying to get stimulants banned from the armamentarium, but they're not benign, and a lot of people don't benefit significantly. So if we can address the root cause, we also can remove the label and stigma, because then they're not going to college with a prescription-controlled substance. So I'm going to take questions, but I want to give you 2 learning opportunities before I take questions. This is a barcode it's a QR code you can scan to get more training on mental health genomics. IntelliXDNA does offer a free training and mentorship program. Because IntelliXDNA is a clinical decision support tool, under FDA guidelines, we can only offer it to licensed healthcare providers. Right now, we are offering it to naturopaths, DOs, MDs, nurse practitioners, PAs, chiropractors with advanced integrative training. But if you are a psychologist, since that is also a licensed healthcare provider, please also scan, as we are looking into being able to expand our offerings to psychologists that are done with integrative training. If you have not become part of the fellowship in functional psychiatry, you should scan this and learn more. You can go to psychiatryredefined.org fellowships, or you can scan this QR code. But this is going to give you over 300 hours of clinician-led education with 100 hours, more than 50 CME credits, and lots of other evidence-based protocols. And Dr. Greenblatt and I have talked extensively about this, and we're both dedicated to the same goals. We want to help you practice evidence-based medicine using a root cause approach. So take advantage of these opportunities. Just know that if you are, we talked tonight about ADHD, but genomics can be used for many topics in mental wellness. We have at IntelliXDNA a short form report that's more like 45 SNPs that relate to depression and anxiety, but still has the nutrients and inflammation and such. And then we have a 20-panel report that covers more broad mental wellness. And so you can either go to our website at intellxdna.com, intellxxdna.com, and request a tour and learn more. Or if you've scanned that code, that will work as well. Or you can email me if all else fails. So what I'm going to do is I'm going to pull over the questions. And Cindy, did you have anything to add while I'm looking at the questions? You are on silent.
This has been a fascinating, but you should see all the positive comments, treasure trove of information. For everybody, we will be sending out a link to the presentation and the slides tomorrow. And please do consider our fellowship. We do go over genetics. It's a 1-year